Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar K. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, today we will discuss about a very interesting factor which is explained in Kashyap Samhita. So what is that? That is importance of Chandra or moon in child psychology. Yes, it is quite interesting. Kashyapa explains a special type of samskara called as Chandra Darshana Samskara. That means after 1 month of age, child should be shown with the sun, moon, in the night hours. And this is told in association with the Surya Darshana Samskara. In the daytime, the Surya Darshana Samskara has to be done. Pradoshe Chandramasha. That means in the night hours or evening hours, you have to go for Chandra Darshana Samskara. Now, what is the importance of this Chandra in the development of the baby or child or infant? Now, Chandra is considered as a god Soma. Okay, so Chandram Somatmaka. So it is Somatmaka. It is the one which gives a cool effect, Shithala. Okay, it pacifies your stress. Okay, so it relieves your stress. And more than that, in the Vedas, it is very clearly told that. That means we know that Loka Purusha Siddhanta, we know that. Whatever the things which is present in the nature or universe is also present in our body, isn't it? So similarly, the mana which is present inside our body, externally or universally, it is represented by moon. Chandramo manasi jataha, jata takshu ajayataha, told in Purusha Sukta. That means the manas which is present inside our body or inside this physical body. So that is basically the reflection of moon who is present in the universe. So your mind or child's mind or psyche is continuously and always get influenced by the status of the moon. So Chandrama Manasi Jata. Therefore, it is quite common in childhood practice, which cannot be explained in contemporary medical science, but Ayurveda medical science can beautifully explain this particular concept. Most of the time, I think everybody would have been experienced that few children, they show some exaggerated body activities or sometimes abnormal psychological behavior, a sort, not up to the greater extent, to some extent, during the full moon and no moon days, Amavasya and Purnima. Many times parents directly they complain. As soon as the Purnima nears, so his behavior will going to change quietly to some extent, and after Purnima again he will be normal. Every Purnima and Amavasya, so he will have some extra activities, abnormal activities or over activities, etc. So now this clearly explains the concept that how mind is controlled by the Chandra. During the Purnima, Shukla Paksha, what happens is the strength of the moon is going on increasing. Strength of the moon is going on increasing. And as a result, the same is also reflected on the manas of the baby, and the child is also having some exaggerated or hyper activities. Child will be more happy or more playful or more active and doing more playful activities. And during the Amavasya, in the Krishna Paksha, what actually happens is the strength of the moon is decreasing and child is also showing some of the depressed activities. And in the Amavasya, these particular depressed activities will be peak. So parents will appreciate this as some abnormal psychological activities. Child is otherwise normal, but as he is nearing to Amavasya or as he is nearing to Purnima, he is showing some changes, some minute changes in his psychological activities. This may not be appreciated in all the babies, but in many babies, most of the time, this is appreciated. If you ask the mother carefully, definitely she will give this particular history. So this shows the influence of the manas or influence of the moon over the manas. So this concept is very beautifully explained in Ayurveda, well explained in the Chandra Darshana Samskaras. If the baby is crying at night, suppose if the baby is crying at night, it is very difficult to console. Then show the baby to the moon. So bring the baby out of the home and expose to the moon rays. Now, moon is the reflection of the manas, and when the moon rays fall on the baby, or when the baby is visualizing the moon, definitely its mana becomes shanta. A crying baby now become quiet or maybe start laughing by looking at moon. Such a beautiful concept is explained in Ayurveda by Kashyapa. Okay, he also explained Chandra Darshana Samskara, and he also mentioned about this particular pakshat, the changes that can occur in the baby. Of course, the power of the moon, we know that. Moon is able to shake the ocean itself during the Purnima and Amavasa. So why can't the baby? So this clearly shows the influence of the moon over the manas. Therefore, a patient who is psychologically depressed, he should be consistently exposed to the moon rays at night hours. A patient of mental retardation, patient of autism, patient of attention deficit disorders, hyperactive disorders, and patient of mental retardation, some other learning disabilities, okay, some abnormal behavior. So we have to make a practice of exposing this baby to the moonlight. That gives a very good effect because moon is the best healer. He will correct the manas. Mano Vaichityas will be corrected by the moon. So this is a very beautiful concept explained by Ayurveda, and this can be well employed in children. Thank you very much. Again, we will meet again. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you.